Today we're going to be talking about excessive hair growth. Why does that happen and how can we reverse it? So stay tuned. Why do we have excessive hair growth if we have PCOS? Excessive hair growth is always combined with high testosterone levels. So, our high testosterone levels are most often combined with insulin resistance. If you haven't seen my insulin resistance playlist before, please make sure you watch those videos, because that is going to explain to you what is insulin resistance and why we need to reverse it to actually reverse our symptoms. So around 70-80% of women with PCOS will have insulin resistance at some level. We have insulin resistance. This causes high testosterone levels. High testosterone levels cause acne, cause hair loss, and cause excessive hair growth. People will have different levels of excessive hair growth. Some of us might have just few whiskers on the chin, some of us might have few hair on the belly, some of us might have quite extreme facial hair, or maybe chest hair, belly hair, generally hair in the areas that are usually associated with male hormonal profile. So if you have that, you're probably going to be prescribed testosterone blockers. So if you've seen my videos about acne and PCOS and about hair loss, it will be the same therapy. So you will be prescribed testosterone blockers and both birth control, because again, if you're going to be prescribed testosterone blockers, if you will get pregnant at the time that you are on this medication, if you get pregnant, especially with a boy, it can hurt the fetus. Now, it will help, it will. However, as soon as you go off those medications, the problem will come back. What to do to reverse it? Now, especially if it goes to excessive hair growth. This is very difficult subject because it is very sensitive subject, and many women who struggle with it are quite embarrassed. We usually don't feel comfortable with that happening to us. If you address your high testosterone levels by diet and by exercise, you should see the results. Now, what is tricky with excessive hair growth is that to see the results, it takes the longest time. You know, when we struggle with acne or we struggle with hair loss, those are both very, very severe things, but we can somehow live with them if they are not super extreme and super painful. But having excessive hair growth, especially on our faces, can make us feel very, very insecure. What I would recommend, if you have very, very severe case of excessive hair growth, you might want to decide to go on medication. I am not a big proponent of medication because, as I just said before, as soon as you go off it, the problem is going to come back. So what if you want to get a kid one day? You're going to go off it and you're going to start struggling with that again. Plus you might have acne back and hair loss, maybe all three at the same time, maybe anxiety as a side effect of testosterone as well, which we don't want. What you're going to want to do is reverse your insulin resistance, so check that video and start by quitting sugar, quitting processed carbohydrates. Maybe you will have to do extreme intermittent fasting, and if your body is really, really resilient, you might even have to do intermittent fasting and keto to cut out the carbohydrates and lower your insulin levels very, very low. I'm not saying that everyone is going to have to go that far, but it depends on your body. Another very important thing to know that I already mentioned is that the results from this might start to be visible 6 to 12 months after it starts working. So for example, in my case, I went off birth control 3 years ago. I never had extreme extra hair growth apart from a few whiskers on my beard, but I struggled with acne. So for me, being keto and intermittent fasting for 4 months after working towards it with intermittent fasting, whole foods diets for 3 years, I just started seeing results now after being extreme intermittent fasting, extreme keto. So I slowly lowered my insulin levels for 3 years. And now, if you have excessive hair growth, if you would be on this level that I am now you're in the low insulin state. But it might take your body another 6 to 12 months to start changing your hair growth. This is not a quick solution, but if you are going to make it your lifestyle, this is a permanent solution. If you're struggling with excessive hair growth, I understand if you will decide to go the medication way, but maybe considering changing your diet at the same time and changing your lifestyle at the same time and incorporating holistic ways at the same time. So when you go off medication, you're already at a completely different level and you might be able to manage this naturally. What else lowers our testosterone level is a spearmint tea that you're gonna want to drink around 1 or 2 times a day. Every day it's delicious. You can add some stevia to it, or erythritol, or monk fruit, or any sweetener that is gonna keep your insulin quite low. Another thing is you're gonna probably want to lower your stress levels and increase your sleep, because that also lowers our adrenal hormones, which can also contribute to high testosterone level. And of course you might want to try and think what kind of hair removal method you will decide to go with. And there are plenty ways, but of course every skin is so different, and for some of us we're gonna get red bumps after waxing or after tweezing. So you might also look into the hair removal processes. I would recommend to search for the groups and for forums where women are exchanging experiences. It also helps a lot with your mental things connected to symptoms like that, because you will see that you're not the only one that is struggling with that. So that is it, and excessive hair growth is possibly the only thing where I would recommend going both medication and holistic ways, and slowly move into holistic ways only. Please like this video, subscribe, and click the notification bell so you're notified about future videos, and leave the comment down below. Do you struggle with excessive hair growth? Do you drink spearmint tea? Do you do, I don't know, keto, intermittent fasting, whole foods diet, or maybe you are on medication? Please start a conversation in the comments down below so you can help each other. Thank you. Bye.